Hi, my name is Matt Steinley. I'm going to be talking about foreign bodies and soft tissue. So the indications to perform an ultrasound is that the patient has a history for foreign body. If you want extra help to localize, especially if this is a radiolucent object, if the patient has swelling, redness, pain, mass, fever. So the linear transducer is a probe of choice. It has high resolution and detail. Several transducer presets exist for soft tissue, including small parts, vascular, musculoskeletal, nerve. Use the 75% rule for the object of interest. Have the object of interest occupy 75% of the screen. Leave 25% of the screen posterior to the object of interest to see adjacent structures and shadows and artifacts. Depths for soft tissue foreign body range from 0 to 4 centimeters depending on the depth of the foreign body. If you have a concern for a deeper foreign body, you can widen your field of view or increase your depth or modify or change your frequency or change your probe. Optimize patient comfort while maintaining good probe contact. Use gentle pressure. Use large amounts of gel or a mountain of gel to minimize pressure or pain. Use warm, comfortable gel or water if you're able to. If the object is on the hand or foot, you may consider a water bath or water-filled standoff. You may need a probe cover and sterile gel if over an open wound. Image the area in question in long axis. Repeats in short axis. You always want to see it and kind of mark it out in long axis and short axis. Look for tissue reaction, such as a hypoechoic ring or the halo sign. Look for posterior acoustic shadow. Look for reverberation artifact. Look for adjacent cellulitis, cobblestoning, or abscess. Measure the foreign body in both planes. Label and save all of your images. So this slide reviews normal anatomy of skin or soft tissue. At the top we've got skin or epidermis, subcutaneous tissue. These hyperechoic lines in here are fascia. We have some muscle down here, we have some bone. We'll go ahead and play this video. So once again you can see the subcutaneous tissue, which is hypoechoic. Epidermis is often hyperechoic, fascia is often hyperechoic, muscle can be hyperechoic or hypoechoic, and then bone. So be able to recognize those normal anatomy structures. So notice you've got your epidermis up here, subcutaneous, and you can see what looks like foreign body with some shadowing and posterior acoustic shadow. This was read as a linear foreign body seen just under the skin surface. Here you can see that it looks like a wood foreign body. You do have this shadow, this posterior acoustic shadowing. So foreign bodies can be different. Metal tends to have the most reverberation of the foreign bodies. You can see that a glass foreign body has a somewhat similar appearance to metal. The metal has a little bit more reverberation.
Stop, look, and listen. This wood splinter is deep and trapped inside the muscle fibers. This is not going to be a quick and easy bedside removal.
So reviewing some pearls and pitfalls. Accuracy is often based on the type of foreign body. POCUS by experienced emergency medicine physicians for detecting gravel, glass, plastic, wood, and metal. The sensitivity is approximately 96%. Both radio-opaque and radiolucent foreign bodies appear hyperechoic initially on ultrasound. Hypoechoic halo usually become present around 24 to 48 hours. Ultrasound can help guide foreign body removal. You can see a halo sign or some fluid edema around the foreign body. This is caused by an inflammatory reaction, more common with organic foreign bodies and those that are less acute. Wound was more difficult to detect than other types of foreign body. Size does matter. Little tiny small things are going to be harder to see. There are mimics with foreign bodies. Air can be a mimic, can even have some reverberation. Care must be taken to scan through the entire tissue area systematically and in two orthogonal planes to not miss the presence of a foreign body.
Stop, look, and listen. Both these patients had open wounds. Trapped air can appear like a soft tissue, foreign body, and even create a shadow artifact. Try to gently compress, irrigate, or inject local anesthetic to see if this artifact disappears.
This is a 10-year-old male who presents to the emergency department. 3 weeks ago, the patient was jumping up and down on the bed and fell onto what he believes was a piece of metal from the bed frame. For the past week, he's had increased pain and swelling and has been unable to bear weight on the extremity. Looking at the wound, he has petechiae on the plantar aspect of the foot, a scabbed over area that is raised with pain to palpation and induration. X-ray shows no radiopaque foreign body. On the ultrasound, you can see image on the left, it's in a long axis, and the image on the right, it's in a transverse image. It looks kind of circular and tube-shaped. The impression is a large foreign body within the soft tissues of the medial right foot, just 2 to 3 millimeters deep to the skin surface, with surrounding inflammation but no visible fluid collection. You can definitely see some reverberation of this object. The foreign body was identified and removed with forceps. The wound was then irrigated with 400 mL of sterile saline. There were no complications. After this, they had a repeat ultrasound to make sure that the foreign body was out completely. There is a curvilinear focus of increased echogenicity in the wound. The wound is irrigated again. Nothing else came out. Additional imaging of the wound with and without compression demonstrates that the linear focus of increased echogenicity becomes less defined and vanishes with compression. The appearance is most consistent where the focus of gas in the residual foreign body is present. So in summary, it is helpful to not only assess the appearance of the foreign body, but also the surrounding tissue reaction and the degree and nature of the posterior artifacts, which may be reverberation or posterior acoustic shadow. If the foreign body is present for more than 24 hours, likely will have a hypoechoic ring or a halo sign. Precise localization and measurement of the foreign body should be performed to maximize the ease of removal and confirm that it was all removed. Foreign bodies can be very subtle and easily missed, especially if small. If there's any uncertainty, consider radiology performed ultrasound or close follow-up for a wound check or other additional advanced imaging.